My name is Dr. Ruth Mary Allen, and this is my podcast, Brain Health Unchaining Your Pain. Our world has become a minefield for our children to get the best out of their brain and whole body health, which is why I founded the Wellbeing Warrior Academy to help them navigate this minefield effectively. Right now, if you go to www.wellbeingwarrioracademy.com and use the code podcast10, you can get 10% off all programs. That's www.wellbeingwarrioracademy.com and use the code podcast10 at checkout. Now, let's get back to this week's episode of Brain Health Unchaining Your Pain.
Welcome to the show, Brain Health Unchaining Your Pain. And I'm really looking forward to this conversation with the wonderful Dr Hokehe Eko. Welcome to the show today.
Thank you, Dr. Ruth. It's a pleasure. Yes, it's been a long time coming. I know.
I know. And I think we connected via Fallon Jordan through the Amen Clinics. And I know we've been hoping to have this conversation together for some time. So I'm really excited that we finally found the time and got our diaries together. So
yes.
Super excited to have this conversation because I know I spoke to you on your show some time ago, so really excited to do that exchange. So for those that don't know, Dr Hokehe Eko is a mum. She's a paediatrician. She's a TEDx speaker and non-profit founder, and is passionate about helping both children and adults boost the health of their brains, so that they can thrive in every area of life. She loves to help children with ADHD go from fidgety to focused. I absolutely love that, by addressing the root causes of their behaviour. And I'm really excited to dive into that today. But before we start, I'd love to know what you're passionate about in life right now.
Thank you again for having me on the show, Dr. Ruth. Yeah, so right now I am passionate about talking to as many people as I can about how can we get healthier? How can we pay more attention to what's going on here? Because this is what drives everything that we do. So that's the way I approach it with kids, with adults, like Dr. Ruth said. So that's what I'm really passionate about, because I feel like if we don't pay attention to that, then we're really missing the boat. And yes, we're not trained as physicians to talk about health from the angle of the brain. But I found that when I do that, it like lights up either the child or the adult, and it makes them more likely to make changes than if you just say, yeah, drink some water, eat some veggies, the usual stuff. So.
Do you know, I think that's so true. And I find this in the clients that I talk to, that it's a really much kinder conversation, it seems, when we talk about it through the lens of brain health. Right. Because we're not talking about them being the issue, and, you know, we're talking about their brain struggling and that they've got the power to direct their brain to make the right decisions.
Right.
And it's really great for kids too. And I'd love to hear your thoughts on this from your perspective, because it's easy to teach them about their brain, because it's the same way as you teach them about their heart. It's an easy topic of conversation.
Right.
And you know, my daughter Lily, and I know you've got kids too, is that we talk about her soldiers in her guts. And so we talk about the good soldiers and the bad soldiers, and it's a great conversation to have with her about making sure that her soldiers, she's feeding her soldiers to make them strong.
I'm going to have to borrow that.
Yeah, no, you're welcome to. I wish everybody would, to be honest. It's such an easy conversation, and we talk about feeding her family in her guts. And then she loves watching videos of the microbiome and how her gut talks to her brain. And she says, "Mummy, can I watch the video of the microbiome while she's eating her breakfast?" And she's 3.5. But we don't give children enough credit to what they can learn. you know. And I think it's such an important topic, talking about the brain and how it's connected to the body and how they can influence the outcomes of their lives.
Yes, you're absolutely right. It reminds me of when I taught my she's 5 now, but when she was 2, I taught her that after I learned this from Dr. Amen, I taught her that blueberries are God's candy. Oh my Lord. Since then, she tells everybody who will listen. And that's why they all need to eat their blueberries. I'm like, thank you so much.
Yeah, I know. And I totally agree. And also I teach my daughter that sugars feeds her bad bugs. So you don't want to feed the bad bugs in your gut, because they'll kill the good ones and make them poorly. So, it's these simple concepts, isn't it, that children latch onto, and they really become the warriors, don't they?
Yes.
For their health. So I'd love to know, before we dive into your area of expertise and the topics that we're going to talk about today, what for you is optimal brain health in the context of your life's journey?
So that's an excellent question. So for me, optimal brain health is me being, first of all, aware of who I am, where I am in regards to circumstances in life, like where I am right now. And first of all, being aware and also recognizing what's in my control and what's not, and being authentic to myself and asking myself, so what can you do better? Because I feel like the reason we're all here is that every day we are better, right? And we treat others better, and every day we try to do better. So that's for me, because I understand that whatever I focus on grows. So if I focus on changing, on growing, on being the best version of myself, then that makes my brain happy, and in turn makes me happy. So it's a very good cycle I've found to that I've gotten into. So
yeah, and I think it's so important, that awareness piece, because I certainly had zero awareness when I was a child about, my brain, even though it's the engine that runs everything. But I really had no clue how powerful it was and how vulnerable it was at the same time to the world around us. And I know you mentioned, your awareness of where you are now and what you can do, what you're empowered to do to change.
Right.
Has there ever been a time for you where you haven't been able to dial those elements of your brain health in, and starting with the awareness?
Oh yes, absolutely. So yeah, I'll tell you my own brain story. When I was a junior in college, I was in 2 car accidents, like exactly 6 months apart. So I got discharged from physical therapy on a Friday. On the very next day, I had the second one. So Monday, I was right back to physical therapy. So, but
Wow.
what happened was, because I had concussions both times, and I started not to do well in school. So I was sent to go see a neuropsychologist who tested me, asked me what I'd like to do. And I said, well, I was a junior in college at that time. So I said, I've always wanted to be a pediatrician since I was 5. So the guy proceeded to tell me, or the doctor, I should say, proceeded to tell me that, well, listen, you're only average. In fact, you're even below average. Um, there is no way you're going to medical school. Like you're not going to medical school. He didn't even say maybe try. He said you are not going to medical school. So I highly suggest you go find something else to do. So you see, I wasn't aware of the brain and how it works, because I totally believed this guy. And of course, because I believed that I was less than average, I went from an A student to an F student, like flat.
Wow.
And so I had to withdraw from college that semester. But my parents, of course, were like, well, fine. And then, of course, before the next semester, I was on antidepressants. I was just not doing well at all. And they were like, oh, you're going back to college. It doesn't matter what he says. So that's an important piece with brain health, is the relationships that you have around you, right? Even if it's just need one good person to speak into your life. So my parents consistently told me I was their doctor, and that I just needed to go back to school. So of course I went back to school. I wish I could say it was easy, but it wasn't, but I made it. So, and looking back now, that consistency of hearing, you can do this, you can do this, I started to override what I had heard and believed.
Mm-hmm.
I started to think I could actually do it, and I did it, right? Even though I went through hoops and all of that, I still did it because I started to believe that I could. And so that's like a really critical thing is knowing that our brains, we are not stuck with the brains we have. Our brains can heal,
Mm-hmm.
our brains can make new connections, and I think, and I always tell people this, like, that's a really good, no matter how bad things are, that's a good place to start, just to remember
Mm-hmm.
like the power of your brain and
Mm.
the capacity you have to change.
I love that, and and I think it really resonates with me. Although I didn't listen to the people that believed in me, I got stuck, and when I finished my first degree, I was really interested in doing medicine, and I went to the careers advisor and said I really considering doing a medical degree
Right.
on top of my physics degree, and
Mhm.
they said I don't think you're intelligent enough. You need to go into you'll be better, you do these online assessments, although online
Right.
then was, you had to get a cassette recorder and a handle and wind things up to get things online. But I
Right.
did this online assessment and they said, oh, you're much more suited to sales. And I
Wow.
thought, I don't want to go into sales. So I went up and furthered my education and got an MSc distinction and went and did a PhD.
Wow.
But I did, I did listen to the naysayers
Right.
and didn't pursue the path that, I really was interested in. But I did pursue one that I really wanted to anyway. But it's very easy, isn't it, to get stuck in that negative self-talk that somebody has given to you. And it's like a broken record, as in, like they cut you once, but you cut yourself 1,000 times.
Right.
And it takes a really long time to rewire yourself.
Right.
To realize that you're good enough. And I love that you said that you just need that one person that truly believes in you,
Right.
which could just be you.
Right. That too.
Yeah. And you just turn down the volume of negativity and you turn up
Right.
the volume of positivity and get to choose who you listen to.
Absolutely. You're absolutely right. It is important. I often hear about the 5 people around you, like, indicates like who you really are. So it's important to surround yourself with people who will speak good, speak life, not speak can't. So
Yeah.
yes, to go back to what you said, yes, there might not be those people around you, but wherever you are in your life, you can, if possible, seek out people who will speak good to you. And
Yeah.
of course, it always starts with ourselves, like you said. Yeah.
Yeah. I love that. And I'd love to, obviously you went on your journey to become a paediatrician. Could you take us a bit on the journey? Because obviously you had these 2 major concussions,
Right.
and they put you on antidepressants. And I'm assuming actually you had to let your brain heal because it was traumatized from a physical concussion perspective, and there was a lot of bruising of the brain. How did you overcome that particular trauma, and where did that lead you in the context of getting that fascination about brain health?
Yeah. So so I went back to school. I still struggled, but over time I kept getting better. I got tutoring. My parents were big on healthy eating, so that helped without me
Uh-huh.
really knowing it would help. So that helped. And yes, I took several detours. After I finished I was a chemistry major, and then I switched over to psychology because I just just couldn't handle the
Oh,
organic
chemistry is tough.
chemistry anymore. That was taxing to my brain. I was like, okay, never mind. So I switched over to psychology as a bachelor's degree. I did end up graduating with my classmates. And then I just wasn't sure what to do because I still kind of in my head really didn't think I could go to med school. So I went to do a master's in public health in tropical diseases. That was
Wow.
fun. I went back home to Nigeria and did some work there on malaria. Then I came back and I was like, okay, I'm just going to apply to nursing school because I don't think I can get into med school. So I did all that. I applied to nursing school, and my siblings were like, what are you doing? You've always wanted to be a doctor. What in the world? So, yeah, I almost went. I got into a PhD program for nursing and I almost went. But last ditch effort, I was like, okay, I'll just apply to med school. And I got in. I was like, oh.
Wow.
So I must say before then, I did fail. I think I took the medical school exam twice. And that just, after that, I was just like, okay, I'm done. I guess the guy was right after all. But then I took it the third time and I did do way better because I changed the way I was studying.
Uh-huh.
So I have learned along this journey to own what seems like failure. But now I don't view it as failure. I just view it as just a rung on the ladder, right? To get me
Uh-huh.
to where I'm going. Because if I didn't fail, then I wouldn't push myself to figure out how my brain studies better, right? I wouldn't push
Yeah.
myself to figure out ways to walk around or strengthen things that needed strengthening. And of course, the belief in myself. So there's something about failing something and trying it again and getting it that does something to the way you think about yourself. So that definitely helped. So after the master's in public health, so then I got into med school, yes, and then I went to med school, and that, wow, medical school was something. But I made it. It was
Yay.
hard. It was like the hardest thing I've ever done in my whole entire life. Oh my word. Yeah, so but I made it and I got into residency training in pediatrics, which is what I've always wanted to do. So, it all worked out despite all those hiccups early on. And the quote unquote the failures and the
Yeah.
falling down and getting up, the falling down and getting up. And yeah, so it was by no means a smooth ride, but that's life, right? Right? Life
Yeah.
is never smooth. So it's good for us to talk about the downs, the ups, and not just give people a sense of, oh yeah, I just got there.
Yeah. Well, I think it's so important though to acknowledge those bumps in the road.
Yeah.
Because if you don't acknowledge that they were there, you don't know to avoid them next time.
Right. Yeah. And
You
then
don't learn, do you? If you know, like you said, you had to learn
Mhm.
how to use your brain to best effect and learn to best
Right.
effect. And it required a different strategy.
Right.
And that's okay. Because
Mhm.
everybody's brain is different. The way
Right.
that I learn is not going to be the same way as you learn. It's not going to be the same way as the person
Right.
next door to you learns. That's just not the way it goes.
Right.
And I think it's really important that we give people that opportunity to find the
Right.
right way to do it for them and for
Right.
their brain.
Yeah, absolutely. And side note, because I'm a pediatrician, that's something kids struggle with if we are not attentive as parents to really pay attention, or even as teachers too, to pay attention to how does the kid learn? Because yes, the classrooms are full and then nobody has time to figure out how you learn best. But so I guess that comes back to parents. If you find that your kid is very visual, then help them with their homework in visual ways. Take them to the zoo so they can see the animal. Take them to museums so they can see the things. So then it imprints in their minds and it sticks versus them reading a book or just doing the usual stuff. So that's just an aside.
And I think that's a really important topic. But what is it that helped you? What was the answer for yourself in the context of learning? What did you discover on that journey for you where you had to adapt your learning styles? What worked for you personally, if you don't mind sharing?
Oh, sure. So I of course started off just reading the books or sitting in class and attempting to take notes. And I found out I couldn't really remember that way. So then I discovered, okay, if I wrote down the flashcards myself, then it helped me remember it the first time. And then I read the flashcards again. Like everywhere I was, I would just be going over flashcards. And that's how I was able to get the memory to stick versus
Yes.
some people will just read it once or twice and they will get it. I had to write it out myself.
Yeah. I had to do that. And I held on to my flashcards until recently, and it was really difficult throwing them away because so much energy and effort went into writing them with different colour pens so that you could remember the information. And actually, at the time that I was studying my MSc, was just like really intense. I was going out with a trainee doctor, and he was brilliant because he had that mindset of, you know, revision. And I don't think I would have got a distinction if I hadn't been going out with him, because I kind of was forced into learning and finding different ways.
Right.
And it was the flashcards that won it over, and that's what he used as well. So
yeah.
I can really relate.
Yes, things we have to do, right?
Absolutely. And so then you transitioned, obviously did your residency, and then what led you into brain health itself?
Yeah, so I kind of buried the story about me having accidents and that whole thing. And it was just like life as usual, got married, had the kids, attending physician. And then one day I came across Dr. Amen's course. I don't know, I think it was online somewhere about brain health. And that's triggered the memory of, oh my gosh, this happened to you. And yeah, you got to take this course. So I think it was the Brain Warriors Way.
Oh, okay, yeah.
I signed up for it and I was like, oh my goodness. That's how I got back into the whole brain health thing, because I stopped talking about it. I just, it was like this thing hidden somewhere in my brain.
Yeah.
So yeah, when I saw the course, that triggered the memory. And so then I was like, oh wait, this did happen to me. It sounds strange, but it's true. So when I did some more, so I did the course and then I did the brain health certification. And then I started attempting to try it when I was working with kids. And then I was like, oh my goodness, they're actually paying attention. Oh, whoa, they're actually listening. And they're making changes. Oh my goodness, they're actually eating their veggies now. This is amazing. And so, and then around the same time is when I realized, oh wait, there's more we need to do with kids with ADHD. Like, why are we just handing them all these medications? I'm not against medications. I prescribe stimulants. So, but I was like, we have to keep them medicated all day long. I think what did it for me was I had a patient who was on one med in the morning, one in the afternoon, one for after school, and then something to sleep with. I was like, then the mother was asking me for more sleep aid. I was like, there is no way I'm giving your kid another med. In fact, I'm going to start cutting back. I mean, no, he has to learn how to sleep.
Yeah.
We can't medicate him for the rest of his life. So that's what made me start thinking, isn't there another way around this? Isn't there more to this? And that's when I discovered functional medicine, integrative medicine. I was like, oh, we didn't talk about this in medical school. So I did some training on integrative medicine for ADHD in kids. And I was like, wow. And so when I applied it in the clinic, I started getting these results. Like some kids, like for example, I'll tell you one story about a girl. She was 12 and her mom said, oh yeah, the teacher said she has ADHD. And I'm like, the teacher said, okay. So tell me more. And I asked this one question, how old is your house? Right? And she says, oh doc, you're gonna think I'm crazy. When me and my daughter and the dog go in the house, we feel sick. When insects fly in our house, they fall down and the insects die. I was like, the insects die when they fly in your house?
That's not good. That's a sign.
I said, okay, mom, can you do me this big favor? Can you and your daughter not go back to that house today? She's like, well, I have to go back, but my daughter, I can put her in my sister's house. So I was like, okay, do that. And I'll see you in 6 weeks. So 6 weeks later, this kid comes in and she no longer is hyperactive. Well, she has not been in that house in 6 weeks. And then they find out they have this extreme case of black mold. I was like, oh wow, who knew?
Yeah.
You see, usually we would just say, oh yeah, these are your symptoms, here's some med. We would not ask the questions about what's going on in your environment. Is there trauma in your background? What kinds of foods do you eat? How is your sleep? That's a really big one, and then I would have stopped this kid with stimulant when she didn't have ADHD and it was something in her environment, and then that would be slowly killing her and her family, so that's what led me to do my TEDx talk, because in the talk I'm just simply talking about, I'm not saying let's throw away stimulants, because it does help some kids that really need it, but all I'm saying is let's ask these questions around environment, the physical environment, the emotional environment, what's going on, before we just hand them the meds.
Yeah.
So yeah.
No, and I think that's so important. And you've just cited one case, but there will be millions of children out there who will be struggling with cognitive issues. And the root cause of the issue is toxins in their environment.
Right.
And nobody's checked for it or asked the question, like you say, to understand whether they've experienced mold exposure, or it's the dyes that are in the paints, or the toxins in the paints or in the floor or in the furniture that's causing them their hyperactivity or their breathlessness, or whatever it may happen to be. And it can play a huge role in their cognitive health. And and I think it's really important. I love this topic because people don't talk about the impact that our changing environment is having on our kids enough. It's such an important subject, because over 50 years ago our environment was very different to the one that we have now, like very different.
Even the food was different, everything was
different. So we've grown up, you and I, in an environment that was very different to the children that we have, and they're experiencing different toxins to the ones that we experienced as kids, which is affecting them. And people aren't paying enough attention to this impact that it's having, unless you could take a functional medicine approach. What do you think is the biggest cause from the clients that you've seen in the context of children that is affecting their cognitive function? Is there something that really kind of continues to jump out as a root cause problem for children?
Yeah, it's the nutrition, what they're eating. Because when they eat foods, lots of kids who have been diagnosed with ADHD also have constipation, also cannot handle dairy and gluten, but that's what's in most food, right? And that's what they really drink. So I have seen dramatic improvements when you just take out those two foods, because those two things cause inflammation in the gut, which will inflame the brain. So it's like explaining that to the parents: whatever you put in your mouth ends up here. And so that's what I found. So that's where I usually start. After we talk about your behavior, second question is, are you constipated?
No, I agree.
Are you sleeping? Because ADHD could also be called the sleep disorder. If you don't sleep, you won't behave right, and then the cycle just goes on and on. Meanwhile, all we are doing is medicating
the symptom.
Yeah, the symptom, and we are not addressing anything else. So, and the parents don't know to bring it up and say, hey, my kid doesn't sleep, then we give you a pill for it. We don't exactly address how we can optimize your sleep. So
yeah, I suppose you could remember it as easy as eat, sleep, and environment.
That's a good one.
It's easy. Eat, sleep, and environment. Because it really is those things for kids, isn't it? Whether it's the environment from a toxin, like external to people, or people toxin.
I really like that. Eat, sleep, environment.
Easy. But I totally agree with you. The clients that I've had, whether they're adults or children, but often if I have children coming in, you can tell there's a dietary issue, when they've got behavioural problems,
Right.
And you immediately know when you do a detailed evaluation by asking the right questions. How's your how are you? How's your digestive system going? Is it working or not? Do you have any gut ache? Do you have any stomach ache?
Right.
And I don't think very many parents really. So if you're a parent out there, please listen to this. Is that gluten and dairy can hugely impact your child's health, both
Yep.
digestively and cognitively.
Yes.
Uh,
Absolutely. Yeah. With my own kid, my own daughter, she's so I just noticed gradually her lips were turning black. I mean, like jet black. Like her lips are usually my color.
yeah.
And they went black. I
Wow.
was like, what in the world is going on? So I went to the dermatologist. They were like, what? Went to the allergist. Allergy tests were negative. I'm like, how is that possible? She has a line across her nose. So she's obviously allergic. How is your test not showing up anything? So of course, then I came across, that was around the same time I was looking at functional medicine. So I came across this
Mhm.
blood test I did at home. She was allergic to gluten, dairy, cashew, pineapple, all the things we were eating. So I was like, okay, the entire house is going, we're taking this all out. So took it all out. Voila, no more. Her lips went back to being pink. It's like, wow. So did the allergies improve?
Mhm.
And her moodiness improved. It was like amazing. Like, wow, okay, so my entire all of us at home now, that's just we just eat gluten free and and dairy free. We just kept it that way
Mm.
because I have seen the difference in my own home. Like, wow.
Yeah, I mean we're not 100% gluten or dairy free, but I certainly notice my daughter doesn't tend to have gluten or dairy. She's not hyper allergic to it, but she doesn't tolerate it brilliantly. And
Hmm.
I know for myself, I've done the elimination diet through the Amen clinics, and I definitely do so much better off of gluten and dairy. And funnily enough, I had digestive issues when I was young. And I used to have
Right.
sinus issues when I was young. I was constantly in and out of hospital on antibiotics. And
Right.
as soon as I eliminated the dairy,
Hmm.
I've not been on any
Antibiotics.
antibiotic medication for 6 years.
Wow.
And I would be on it I mean, obviously we've had COVID, but not for
Right.
6 years. But I would be on it probably twice, 3 times a year on antibiotics.
Wow.
And
A lot.
I no longer.
Wow.
From a very young age, not really, really young. So,
Wow.
it's so important. I'd love to dive into the topics that I really want to talk about is courage first, and how can we find that courage? And I know you talked about it a bit in your life's journey. Is that courage to be our authentic self? Would you mind sharing your journey in the context of courage?
Right. Yes. Yeah, courage. That's something I have realized that I have to something I've realized I've been more aware of, and I've been intentional about growing it in my life, which can be scary. So yeah, courage to say no is a big one for me because I was very introverted and I will just usually go along with what anybody said just to keep the peace, even though internally I'm fuming or I'm resentful, and I would never let it show. I would just be like, okay.
Yeah. And
And,
that's a really big one, isn't it? Especially
mhm,
if you're an introvert, because you end up taking the world on your shoulders and you just can't carry the load.
right. And I could literally feel myself dying inside, but then of course you have to like put the face on and smile and all of the things that we all do. So yeah, courage to say no to being not treated right. So
Yeah.
I resigned my job in October because they were harassing me, and I was like, okay, that's it, all done now. But that took, I know I'm saying it like, yeah, it was easy peasy. I was like, what am I gonna do with myself? Like, because it's like almost like you're conditioned to, you have to have a job, you have to this is what you do. You finish training and you go get a job. Not so
Mhm.
much of the you can open your practice, right? You can do other things. So I got to the point where I was like, I can't. I mean, I'm dying slowly just coming to this job, and they're treating me this way, and I'm trying my best. So I'm just gonna say bye and figure it out. So
No, and I think that's really courageous because so many people, you know, had to do the same in the corporate world that I was in, and you
right.
just, I don't know if for you, but for me, it's like a huge weight came off my shoulders.
Yes. Yes.
'Cause you're
I'm
like,
like, I can't
oh,
go back there.
I
No.
can breathe again.
I know. I was, and then for me, one big thing I recognized was I used to be so stressed in the morning to get my kids to school. Oh my word, because they told me if I was a minute late, I would be in trouble. So I'm like, and I'm not keeping patients waiting. I'm like, well, that's so stressful. And I'm like, I have 3 people to drop off. What in the world? So I would hear myself raising my voice or just sounding super stressed, trying to get them, okay, hurry, hurry, hurry. No matter how early I woke up, there's 3 kids in 3 different age groups. The
That is
kindergarten,
super.
all
It's hard enough with one.
I'm like, the teenager wouldn't wake up, the 5-year-old is crying. I'm just and oh my gosh, the first day after I was done, we got to school and there was no yelling. I was like, it is possible to live a life of peace. Of peace and joy. This is amazing. Oh my word. I'm not going back there no matter what. I'm gonna figure this out.
But
Oh
isn't
my
it so important
goodness.
to find that balance? Because
Yeah.
when your work imposes so much stress on you,
Yes.
it affects your relationships, which is what happened to me. You
Yes.
know, it massively impacts how
Mm-hmm.
you can show up for the people around you that you care about,
Right.
and it's not fair on them, is it?
Oh, no, they are so much happier. They're doing better in school. I mean,
Yeah,
my mother is supposed to be kind to them, but it's not like I was I was being mean. But my goodness, I would hear myself sounding so agitated
yeah,
because I am like, they said I have to be at work at 7:45. If I get there at 7:46, it's a problem. It's like, what? What kind of life is this?
yeah. That is tough, isn't it?
And then it's gonna show up in the patients when they like, how are you, doctor? What's going on? Are you
Yeah,
okay today?
yeah,
So it's
yeah.
a bad cycle. And I'm not advocating everybody leave their job for by all means. I'm just saying, say for myself. So so I was able to stop and smell the roses. I've been a pediatrician for 10 years. I've never not like worked back to back to back to back to back like this. It's like, is this possible?
Yeah.
So, but I have started my own practice, but still, I'm doing it on my own terms. I'm not seeing 40 patients a day like I used to. I'm seeing,
40.
okay, that's a slight exaggeration. I used to see like 30 patients.
Wow, that is still a lot. That's an enormous
Exactly.
number of patients.
Exactly. So by the time I leave there, I have no idea. I don't want to talk to the kids. I don't want to do anything. I just want to go to my bed. So it was very unsustainable. So yeah, so I am doing it. I have designed it around my life. So I start work after I've dropped them nicely at school and everybody's happy. And then I work and then I stop work before I have to go get them so I can get dinner ready. So I'm not stressing and all that. So
Yeah.
I am thankful. I mean, I feel like, I feel like maybe I should be pulling my hair out. Shouldn't I be working? I mean, I've had other pediatricians say, "You're too young. You should be working 9 to 5." I'm like, what does that mean exactly? Why do I have to work 9 to 5? I can work 8:30 to 4. That too is fine. And I'm able to take care of the kids well. So I think that's what's most important is being authentic to who you are and where you are in your life, and just trying to, as much as it's possible, make changes so that your work and your life, I mean, there's never going to be perfect harmony, of course, it's life,
Mhm.
but to just make sure you're taken care of, because if our brains and we're not in good standing with ourselves, then nothing else is going to work. So
I totally agree. And, you know, I can resonate with that so much when we end up burning the candle at both ends. And, you know, sleep is often the first thing we drop when we think we're well. And it's the first thing we need when we're poorly. So, you know, it doesn't really make sense that we don't prioritize it, and we don't prioritize that self-care piece.
Right.
When we like are stretching our work time, and I'm guilty of it myself. You know, if you're in a place of passion, it's really easy to get lost in what you're doing,
right.
And forget to look after yourself. But it's also really easy when you're under the cosh, you know, and you're under the thumb, and that people are forcing you to work incredibly long hours, because if you don't, you're out the door, and your job is at risk, and that's really tough.
Yeah. So
now you're starting your own practice. Your focus is on children with ADHD, is it? What's your big focus now?
So yeah, I'm doing a combination of things. So my practice is like house calls. So I'll be going to patient homes to see them. I know, like back in the day.
That is lovely. Gosh, don't people need that now? That personal touch.
Yeah. So that's what I'm doing. And then yes, I'm seeing kids with ADHD, but I'm also starting to give more talks about brain health, which I find I'm enjoying. I talked to a group of ladies 50 and older. Actually, there was a 91-year-old on the call. It was so much fun.
That is brilliant.
And I was like, wait, how is a pediatrician doing this? But I mean, I can. And that's what I realized a few years ago, is that really my job isn't so much to the kid, isn't to take care of the kid only. It's really by extension the parents, because if I can talk all I want about this kid, if the parents aren't in together, I mean, and they're not healthy themselves, nothing's gonna happen. I mean, my kid will end up worse than I saw them. So and that used to get me into trouble at work, because I would spend 45 minutes with the patients talking to the parents, and they would be like, you were in there too long. I'm like, but she needed to talk, so I listened. I mean, isn't this what I'm supposed to be doing?
Yeah.
So yeah, so that's what I do now. So it's a combination of those two things. Yeah.
I love that. I'd love to transition to the fun facts now, because I think it's a great time. So obviously FACTS is the mnemonic for the 5 pillars of brain health that I use as my framework with the clients that I serve. So F is for feelings, A is for action, C is for connections to ourselves and others, T is for thoughts, and S is for surroundings, which I know we've spoken about. So before we dive into the surroundings piece, what feelings or emotions are most important to you in life, and why?
Peace. Peace. Peace is priceless. I refuse to trade it for anything. Not for money, not for anything.
Yeah. I do you know, I don't think we get enough of that these days. No. Because we just always seem to be on, don't we? It's really hard sometimes for some people, and I'm included in this, is just to pause and have that peaceful moment to ourselves.
Yeah. Yes. I hear
giving ourselves that permission to have, to generate peace in our lives.
I like what you said, giving yourself permission, because you literally have to give yourself permission. Because when I left my job, I had to face, who am I? Like, what's my identity without being the doctor in the hospital taking care of kids? Like, I kind of struggled for a little bit. Then I was like, wait, no, you give yourself permission to enjoy peace and figure out how that works how work can fit into your life. So yes, I agree with that. You have to give yourself permission. So
yeah. And I think also when as you reflected earlier, is when you find that peace within yourself, you create, it's like a ripple effect, isn't it? You start creating peace around you, and everybody starts to calm down, and the energy level starts to go down.
Yeah.
And when we engage that parasympathetic nervous system, that's very important. And conversely, obviously, if you're in a highly strung, stressful environment, everybody around you becomes stressed, and you saw it in your kids that their grades were, got better when you created that peace.
They did. Yes, you're absolutely
So
right.
it's so important. And next one is actions. What's the most rewarding or fulfilling thing you've ever done?
Huh. Is say yes to myself. Yes to just being me.
Yeah, I love that.
Not what anybody else thinks I should be. Oh my gosh, it's so freeing. Yeah.
I love that. It's like your butterflies. You're free, like the
Yeah,
butterfly
that's
behind
why I
you,
have the butterfly. Yes, I can finally flap my wings.
and fly.
Yes. Yes.
And rather than being in that cocoon that somebody's squidged you in.
Yes.
I think, do you know, I think that's so important. And I know you mentioned it at the beginning when we started chatting, as showing up as being that authentic you.
Yeah.
And there's only one of you, so because everyone else is taken, and we forget that.
Right. Right. I like how you said everybody else is taken. That's right. So,
But we forget that, don't we? We forget that we can just be who we are.
right.
And we don't have to compare ourselves to others, because there is no comparison.
Right. There
Because
is
we're
no.
unique. So we should just be who we want to be.
Yes, absolutely.
And I just want to expand on this, is because I notice my daughter is noticing things about me that she's like, oh, mummy, you need to do this, or mummy, you're turning into that, or mummy this. And I sort of say to her, Lily, you just got to accept people for who they are.
Right.
Whatever they show up as, you just got to accept them and not judge them. And it's
Right.
kind of really interesting that I'm not sure where she gets it from. She must get it from us at home, I guess. But she's starting to create this judgment
Mm-hmm.
on others. And it starts early, doesn't it? We just
Oh,
start
yeah.
to judge ourselves.
Mm-hmm.
And
Absolutely. Yeah. The story that you tell yourself or that you hear others say about you that you believe and
yeah. So diving into that is the connection with yourself. What's the most important value that guides you in life?
most important value that guides me is truth.
Why is that so important for you? I'm sure there's a great story behind this.
Because I had to tell myself the truth about where I was, what I was doing, what I could
Mhm.
do better, and tell myself the truth that I have a choice. I have a
Yeah.
choice to accept being treated not well, or I have a choice to say, nope, as hard as it is, I'm going to have to not continue this way and do something different.
Mm. Yeah. And thank you for sharing that, because I think it's so easy for us to sort of wander around and lying to ourselves all the time,
Very easy
giving
to
ourselves that it's
right.
okay. And it's hard to face the truth, isn't it? It's hard to tell ourselves the truth, because sometimes the truth hurts.
Yes, it does. But you set
Uh,
it free though.
yeah, I was just about to say that, but it also can set you free.
Yes, it
As
was
Daniel
totally.
Layman says, know the truth and the truth will set you
Yes,
free.
absolutely. It's the truth. It is the truth, and the truth will set you free. Yes.
No, and I think, and this comes back to when you mentioned earlier, isn't it? Is accept where you're at.
Mm-hmm.
Is that, what for you is optimal brain health, is accepting where you're at. That acceptance piece
Right.
is so important. And
Yes.
it's hard to move forward in life if we're always looking in the rearview mirror, if we're
Right.
always looking backwards, or
Mhm.
if we're always looking into the future, not paying attention to where we are now.
Right.
We're never living in the present then. We're
Mhm.
always kind of in some different time zone to the present. And it's important that we just, take a rain check where we are at.
Right. Absolutely. Yes.
I love that. Thoughts. Next one is thoughts. What stupid or crazy thought have you often told yourself in the past that isn't true?
I'm not good enough. And what do I have to say? Nobody's gonna listen anyways. Yes, that one.
Yeah. Where do you think that came from? What do I have to say? No one's going to listen.
It came from a combination of things, environments, things
Mhm.
people said to me, um, feeling like comparing myself to others. Like I
Mhm.
did that one myself. Yeah, like feeling others were better than me. And so therefore the story I would tell myself is, no, you're going to sit in the back of the room. You're not going to speak to anybody. You're just going to be quiet. No, what do you even have to say anyways?
And it's often the people in the back of the room that have the most profound things to say.
Right. But yes, I told myself that for a long time. So yeah.
And it's hard to break that mold, isn't it? Because if you feel that you've been silenced,
Right.
being loud is really difficult
Yes, it is.
because it's safe. You feel safer being silent
Mm-hmm.
because you're not exposed when you're quietly in the background.
Right. Which helps you hide more, which helps you not tell yourself the truth more, which, see, it's such a bad
And
sign.
it creates a vicious problem, doesn't it? A self-perpetuating
Exactly.
negative cycle.
It just goes on and on. It's just wrong.
Yeah. And
So
we don't realize it, do we, that it's happening?
yeah, yeah. But I have found that once I became aware of the impact of your thoughts on your life and how your thoughts actually will show up in your reality. So once I really understood that concept, I can now hear myself talking. I can hear myself saying things crazy about myself, and I try very hard to stop myself and rephrase or like say in my head, no, 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 that's not true, or something like that to catch myself. So it's a process, of course. It's not something easy. You sometimes you fall back and do and listen to the thoughts. But yeah,
Yeah.
if you listen to this conversation we're having and you start telling yourself, I'm going to be more aware of what I say, or I'll only say good things about myself, or even if I tell myself the truth about something I didn't do right, I will ask myself, okay, so what can I do different? That
Mm.
way you're not just stuck with the, oh my God, I didn't do something right. Now what
Mhm.
can we do different? So
Mhm. Yeah, I love that. And I love, and going back to your point of awareness, is that it takes time to have the awareness of your thoughts.
yes,
You can't just suddenly, oh, there's my thought, because you have to pause and reflect,
right,
because your thoughts run in the background and often not checked at all. So
yes,
you have to bring them into the foreground of your mind, which is the prefrontal
right,
cortex. And
yes,
that takes much longer to do than just having them running in the back. So anybody that tries this, it's okay if it takes you a while initially, because it
right,
will, because it's
yes,
like riding a bike.
exactly,
It's
yeah,
hard initially. It just
yeah,
is hard, and be okay with that. And that
yeah,
you just have to keep doing it and doing it and practicing, and you'll
yep,
become more attentive to it,
hmm,
to the thoughts that are running in the daytime. So maybe you start at night time and think, okay, I'm going to check in with my thoughts in the evening. That's often what I do. Try and do it every night to see what thoughts are rumbling along. And then when you get used to that rhythm and that beat of checking in, you'll start going, oh, I'm having a lot of thoughts in the day that I didn't realize I was having.
yeah,
Um,
yeah. It helps too if you write them down. That way you can even see what you're thinking, and then you
yeah,
can,
yeah, exactly. Journaling.
yeah. So when you write it down, I have like, I write it down, then I write the correct thing I should be thinking, or I don't just stop at, oh my God, is this the junk I was thinking? I, I write down what I should actually be thinking, and
Yeah,
like say it aloud to myself, because your brain will go to work to do whatever instruction you give it. So
yeah, yeah.
yes.
I love that, and I'd love to. That's a great point to transition into this the importance of resilience.
Yeah.
Would you mind sharing some of the, why is resilience so important to you? And we've talked about this on the show, on some other episodes as well, and I think it's a hugely
Right.
important topic. But what makes it so poignant for yourself personally?
Yeah, so resilience is just building that, to me anyways. This is my own definition.
No, that's all right.
It's building that backbone, which includes courage, which includes faith, which includes hope of that things will get better, and just it's figuring out the things that you need to correct in your control, that's so that you can continue to make progress in a positive way. And
Yeah.
so what are the things that build resilience? I just said some of them, like courage and hope and faith, because we need those ingredients to build that muscle of resilience that will keep us going, whether we're up, whether the circumstances are good or circumstances are not good. And that ties into gratitude for me, because that's what I've been practicing this year more than ever before. Is I'm going to find something to say thank you about. And I have found that when I do that, it actually makes the things that look hard, sometimes even with tears running down my face, I'll I'm like, I have to find something to be thankful for, because it makes the what feels so dark and heavy not so heavy. It's like a ray of light into my brain saying there is hope. Things, yeah, it feels really hard right now, but it will get better, even though
Yeah.
you can't see it. And it doesn't mean immediately the circumstance changes, but you change, which is the most important thing, because you drive the whole thing, right? So
Absolutely.
when
And I
you
don't think we realize that we do sometimes. We,
right,
especially if we've come out of a dark place,
right,
where we've kind of lost our own internal power because of the circumstances around us, whether there's, it's work or something else.
right,
And we have to find that power within us again. And it can be quite hard because somebody may have snuffed out the spark or that's
right.
inside us, that we were, that passion that we had, of kind of, it's still sort of flickering and a little ember, but you have to put some fuel to it to
Yes,
make it light up
absolutely.
again.
Yes. So yeah. So yeah, you're absolutely right. So resilience can be looked at as a fuel, as a muscle, same thing. It's
Yeah,
all for us to grow in the direction that we need to go in and to keep
yeah,
impacting more people, because that's the reason we're here, right? Is to help people behind us, right?
yeah,
As we move forward, we help the people behind us
yeah.
to do better
Yeah.
as well. So
And I think that's so important. I think sometimes people think resilience is this like big thing that we have to have our arms around, and it's a huge thing that's too difficult to grab hold of. But actually, it can be just simply doing a difficult thing that day that
yes,
you couldn't have done the day before,
right,
or getting up when you couldn't get up the day before. Building those little incremental steps
right. Yeah,
to move yourself in the direction of travel that you want to go, and
yes.
knowing that, okay, it's going to be hard,
Mhm.
but I can still do it. It
Yep.
might take me longer. That's okay. I can still do it.
Yep. That's absolutely right. And the more our brains, what we focus on grows. So if we just keep going back to, yes, we're gonna make it, like Dr. Ruth said. Yeah, we eventually will.
Yeah. Yeah.
Eventually, I became a doctor, right?
Well, I'm a doctor of physics. I never became a medical doctor. So
Well, we are here talking about the brain, which is
we
what.
are talking about the brain. So, so we're all doctors on the same page.
That's right.
So I'd love to know, because this show is all about brain health and unchaining your pain, what one piece of advice would you give to anyone who is, we've talked a lot about people who have put destructive thoughts in your mind and made you feel less than, or made you feel you can't speak up, or made you feel that you're not good enough. What one piece of advice would you give to anyone who's struggling to find that courage, to find that resilience that they feel they need, or generate the gratitude that they're looking to generate in their lives to move forward? What would your one piece of advice be?
My one piece of advice would be to change the thoughts that you think about yourself. So if I just do this one thing, even if you just write out, I will make it, or I can do this. And that's what I've done. I will put post-its on my mirror, right by my bedside, in my car, just keep saying it to myself over and over until I actually believe it. And I found that when I did that, it shifted things in my mind, no matter how dark it looked. Like just reminding myself that I can take the next step. So that's what
Mm,
I would say. You can take
mm,
the next step, no matter how hard it seems. And yes, it is. Things can be really hard, but just remind yourself by making visual. We are visual we're visual beings, right? So we need to see it. So just put it in strategic places where you can see it, and just when you see it, say it to yourself and just believe that.
That's a great piece of advice. And when I went on my journey many years ago now, it feels, is I actually had some statements up on my mirror to remind me of what I could do,
Right.
and to remind me of who I am, and never underestimate the power of a bit of paper stuck in strategic places with some positive statements on them.
Yes,
can really change your trajectory.
Yes.
And your belief in yourself. So that's a brilliant piece of advice. Thank you for sharing that.
Pleasure.
Dr. Hokehe, it's been so much fun talking to you. How can people get hold of you and learn more about what you do and your new practice?
Yeah, so my practice website is www.glowpediatrics.com. I'm on LinkedIn at Hokehe Eko MD. Same thing on Facebook. And I'm on TikTok, actually. Hokehe Eko MD, yes. So that's how to find me.
So do make sure you connect with Dr. Hokehe, because she is an absolute force for good. She's doing loads of great work as well with the charities that you support. I know we didn't even mention those, did we?
Oh, yeah. Oh, goodness. Yeah. It's called Kids of Hope. It's a nonprofit for foster children. And so what we'll be doing is doing training to help the foster parents and the people who take care of those kids, helping them with their brain health. So that they can hopefully help the children, because lots of foster kids are traumatized, like really traumatized.
Really traumatized. So do make sure we'll put that in the show notes as well, to link to that charity too. And obviously, if there's anything I can do to support you and the charity that you support, and to help those kids who so desperately need it, then I'm always here, as you know, to do whatever help I can. So everyone, this show is all about brain health, unchaining your pain. You are not stuck with the brain you have. You can change it, and Dr. Hokehe has been here to show you how. Thank you so much for coming on the show.
My pleasure. So glad I made it. I had fun.
It was so much fun. My face is hurting, my cheeks are hurting from laughing out loud.
Hilariously.
I really hope you enjoyed that conversation. Thank you so much for listening. Please be sure to like and share this episode and leave a review on my website or on Apple Podcasts. If you're looking for opportunities to optimize your brain health or unchain your pain from a past trauma, make sure you visit my website www.ruthmaryallen.com and use the code podcast10 at checkout to get 10% off all programs. And always remember, you are not stuck with the brain you have. You have the power to make it better. You have the power to unchain your pain and optimize your brain power and performance so that you can win back energy and time doing what you love.